Good morning, and welcome to the first meeting of the Health and Welfare Committee for the 22nd House of Representatives. My name is Tina Sablan. I am the chair of this committee, and I will now call this meeting to order. It is 9 o'clock, 9:02 to be exact, and today is Friday, January 28th, 2021. I'd like to begin by introducing the members of this committee. We have to my right our Vice Chair, Representative Leila Staffler, and sitting on this side of the room is Representative Donald Manglonia, Representative Sheila Babata, and Representative BJ Attal. Thank you, colleagues. With all members present, we have a quorum. I would also like to recognize the presence as well from our Legislative Bureau, our House Counsel, John Kuhl, our Legislative Assistant, Claire Sablan, and our Acting Sergeant-at-Arms, Sim Lasua. Our IT Manager, John Diaz, is running our sound system and live stream. We are recording this meeting and streaming live on the Commonwealth Legislature's Facebook page. Thank you, John, for taking care of that. And welcome to all the members of the public. I see representatives from the Commonwealth Healthcare Corporation here today, also the Healthcare Professional Licensing Board. Thank you for being here. A few housekeeping items before we move to the adoption of our agenda. Vice Chair Leila Staffler has agreed to take notes for this meeting, which will become the official record of the committee for adoption at our next meeting. Representative Manglonia has also agreed to keep time during the public comments portion of this meeting. Thank you both. Following the statements of the members and testimony from the Commonwealth Healthcare Corporation, we will be accepting public comments. We ask that oral testimony be limited to 3 minutes. Longer written testimonies or other supporting data may be submitted to the committee today or at a later time. Any questions? I would like to now ask for a motion to adopt the agenda. The motion has been made. Is there a second? Motion has been made and seconded. All in favor of adopting the agenda, please say aye. All opposed, say nay. Motion carries. Our next order of business is the opening statements of the chair and members. And in the interest of time, colleagues, I do ask that we limit our statements to 5 minutes. And I'll begin with mine. The scope of this committee's jurisdiction is quite broad. Based on the current interim rules of the House, the committee may exercise oversight on all matters related to health and the social well-being of the people. This may include clinical services, public health, mental health, environmental protection, occupational safety and health, medical referral, food policy, and social welfare programs. Our primary goal in today's meeting is to lay out the legislative agenda and the priorities of the Health and Welfare Committee for calendar year 2021, and to open the discussion with our partners and constituents and accept their feedback. This is just the first meeting. I do anticipate continued open lines of communication, further development of our legislative agenda, and perhaps evolving priorities. Today, I highlight 5 key priorities that have been identified by the 22nd House leadership that fall squarely within the jurisdiction of this committee. First, to monitor the Commonwealth's COVID-19 response and efforts to protect the health and welfare of our community in this global pandemic. On the whole, the Commonwealth has done a remarkable job thus far in keeping the worst impacts of COVID-19 at bay, thanks to the leadership of the Healthcare Corporation and the COVID-19 Task Force, the cooperation of our community, and the tremendous work of our U.S. Congressman Gregorio Kilili Sablan in securing hundreds of millions of federal dollars for healthcare, testing, vaccinations, unemployment assistance, food aid, emergency housing assistance, and more. Other House committees have expressed an interest in reviewing the management and expenditures of all funds, both federal and local, going to support the Commonwealth's COVID-19 response. This committee certainly has a role to play to ensure that funds are monitored closely and that benefits are reaching the people who need them, particularly through the Commonwealth's health and social welfare programs. Second, to expand access to healthcare in the Marianas. Public Law 2135, the Appropriations Act of fiscal year 2021, directs CHCC to report to the legislature by March of this year on policy options for expanding access to care to reach our goal of universal coverage in the Marianas. I understand we will be receiving some updates today on the status of that work from CHCC's CEO. One major avenue for expanding access to care was made possible in another recently enacted law, Public Law 2128, which authorizes the Medicaid agency to offer a buy-in program to residents who currently lack health insurance and would not otherwise qualify for regular Medicaid. We will be inviting the Medicaid office to brief the members on this and other areas of the program and how we can be of support. Third, to reform and restructure the medical referral program. Every year, the Commonwealth government exceeds its appropriated budget in off-island medical referral to the tune of millions of dollars. In 2020 alone, according to the Secretary of Finance's recent annual report, the Commonwealth spent over $11.6 million in off-island medical referral, while only a little over $1 million had been allotted for the year. This committee plays an important role in working with CHCC, the administration, and the Medical Referral Office, as well as other policy experts, to conduct a long overdue review of this program and identify areas where services could be improved or offered on island or through telemedicine, and where savings might be realized. We also must be involved in monitoring the proposed transition of the program out of the Governor's Office to CHCC and developing legislation to establish parameters for off-island referrals. Fourth, to raise revenue for healthcare and increase investments in our healthcare system. The Commonwealth has some of the highest rates of chronic disease and obesity in the nation, and the costs of a population in poor health simply cannot be underestimated. This committee will support increased investment specifically for healthcare and especially for preventive care through moderate increases in alcohol and tobacco taxes and a reasonable tax on sugar-sweetened beverages. These measures received broad support at the community-wide Fiscal Response Summit held in May of last year, and are backed by evidence that they are effective in promoting healthier lifestyle behaviors. Fifth, to advance the equality and well-being of the LGBTQ members of our community. The Commonwealth ranks among the lowest in the nation in terms of policies in place that provide protections for LGBTQ residents against discrimination, and notably within our committee's jurisdiction in the areas of health insurance, employment in the workplace, and housing. We can and should change that. In addition, in the 21st legislature, Representative Donald Maglonia introduced the Commonwealth's first hate crimes legislation. I ask that this committee support the reintroduction and passage of this bill in the 22nd legislature, and that we work with our colleagues and community partners to see it through to enactment. We have our work cut out for us in this committee, colleagues. I am optimistic that we can do great work together with our colleagues and community partners in this term to realize tangible improvements in the overall health and well-being of our people. I open the floor now for other members who wish to make statements. I recognize Representative Maglonia.
Thank you, Chair, and good morning, members of the committee and the general public. Thank you all for being here. It is a pleasure to be part of this committee, as I've had to answer to many concerned constituents when it comes to dealing with inter-island healthcare and medical referral. My hope is to work with CHCC in addressing these concerns, as well as providing the adequate support to CHCC. In addition, my hope is that with this pandemic, we start to figure out ways in which we can open our local economies with the talks of the travel bubble, and how we can continue to keep our community safe. As a chairman for Ways and Means and a member of this committee, my hope is that we continue this dialogue. Rather than wait to be invited, whether the invitation be from the legislature or CHCC, let us keep the lines of communication open. Let us not wait until the end of the fiscal year or during the budget process, or even when issues become too difficult to maintain. So to the public, thank you again for being here, and thank you for sharing your concerns. In understanding more of the issues and challenges you face, we can formulate ideas, solutions, and work with agencies to address these issues. So please continue to share them with your representatives so that we are better informed and we can start thinking of ways in which we can address your concerns. So thank you, Chair, again, and with that said, thank you all for being here, and we look forward to continue working with you all.
Thank you so much, Representative Maglonia. I recognize Representative Babauta.
Thank you, Chair. Good morning, members. Good morning to the viewing public. Thank you for being with us today. My name is Sheila Babauta, representative from Precinct 4. I'm honored to serve on this committee, as I did in the last legislature. And as our community faces the COVID pandemic, we continue to also see rising rates of cancer, diabetes, and other health issues that affect and impact our community. We can all name someone in our family and our friends who have been impacted by the health crisis in our community. I look forward to working with the agencies in our government, hearing from our community, and as we focus on the priorities that will benefit our people, expanding access to healthcare, improving the health of our people, and overall quality of life. I'm really excited about what we can get done together, and I stand ready to support this committee and to serve with you. Thank you. Thank you, Chair.
Thank you, Representative Babata. Representative Attal.
Thank you, Chair. First and foremost, thank you for allowing me to be a part of this committee, and to the CHCC family, welcome to your chamber. I look forward to continue working with the CHCC and the Professional Licensing Board with the enabling legislations that created your entity so that we can improve your status to be more self-sufficient and be able to collect additional funds for yourselves. So with that being said, Chair, I am ready to continue the work with your committee, and I look forward to many, many opportunities that we can help our people. Thank you.
Thank you, Representative Attal. And Representative Vice Chair, Ms. Leila Staffler.
Thank you, Chairwoman, and thank you to the public and leaders that have come today to share your input and priorities with us today. I know that in our platform, we really talked about how many view healthcare as a human right, and it's extremely important that we find ways to expand and access affordable, high-quality healthcare for all CNMI residents. It is of high concern that the CNMI has some of the highest rates of chronic disease, such as diabetes, heart disease, and the like in the world, in the nation. The rates of tobacco and alcohol consumption, as well as obesity rates in all parts of our community, are alarming, and one of the many root causes of the comorbidities that plague our people. In this pandemic, it is even more concerning. And so I applaud the work of the CHC teams and the COVID task force for keeping us safe up to this point. We want to continue that safety, especially with the idea of opening up the travel bubble. I see it as a really important path forward that we really try to continue to keep promoting the vaccination of our people, because then only can we truly be safer when we do open this bubble, because vaccination will keep our people in a safer place than not. And so moving forward, I thank the community of stakeholders who have taken the time today to come and share your concerns and priorities with us. Chairwoman, I'm ready to begin our hard work ahead, and I look forward to working with this team all around. Thank you.
Thank you so much, Vice Chair Staffler. Our next order of business is to receive testimony from Ms. Esther Munia, the Chief Executive Officer for the Commonwealth Healthcare Corporation. I see that she is here in the gallery, and I'd like to ask our Sergeant at Arms to please escort her to the chamber. Good morning, Ms. Munia. Welcome to the House.
Good morning. Madam Chair, Christina Sablon, Vice Chair Leila Staffler, where is she? Oh, there. Rep. Sheila Babauta, Rep. Donna Manglonia, and Rep. BJ Attal. I am pleased for this opportunity to appear before you today to present priorities for consideration of this committee for calendar year 2021. Honorable Madam Chair and distinguished members, it's been 9 years since Public Law 1651 established the Commonwealth Healthcare Corporation, a public corporation to coordinate the delivery of quality healthcare to all Commonwealth residents in a financially responsible manner. The corporation was supposed to be financially self-sufficient and independent of the Commonwealth government as is possible. While that is also the goal of the Board of Trustees and the leadership of CHCC, There are many issues that needs to be addressed and should have been addressed when Public Law 1651 directed a transition period of 2 years before its autonomy. That did not happen. Instead, the organization was given a $5 million seed money without a proper transition, and no one took the ownership for its struggles and challenges. I bring this to your attention only to emphasize that our priorities never changed since then. Operating the Seoul Hospital and the CNMI's health system is not easy when you have a significant number of uninsured accompanied by health issues in the CNMI. We're trying to provide access to essential healthcare services to everyone and anyone, while ensuring that our health system is strong enough to respond to any emergency. We stood up for Typhoon Solar, Mangkhut, and U2, and we did this with no advance funding to respond, and despite that, we were one of the first ones to return to normal operations because while emergency responses still exist, delaying care to those that need it is dangerous. The COVID-19 pandemic, unfortunately, is like no other emergencies. We were stood up over a year ago, and now we're not only trying to get vaccines to individuals, we're also screening for COVID-19 at our borders, providing mental health and other public health services while still running a hospital. We are grateful for the partnership with the Governor's Office and the CNMI Task Force, the COVID-19 Task Force, Public Assistance, HSEM, DFEMS, DPS, DCCA, Turnkey Solutions, IT&E, and many others that helped ensure we implement evidence-based solutions to our response and to improve the delivery of quality health services. We submitted a white paper on health issues for this body to review. It is targeted at health access in the CNMI and how health financing and the medical referral program play a big role in improving the health of our people. It also listed priorities that should be considered by this body, and some have drafted bills already in existence. They include, in no particular order, sufficient funding appropriation for CHCC, amendments needed to Public Law 1978, fair and reasonable utility rates, marketing restrictions on unhealthy products, Workforce Medical Assistance Act, Substance Use Disorder Prescription Medication Abuse Prevention, sick leave for private sector employees, parental leave for newborns and adoptions, betel nut and tobacco prevention, designated lactation space for employees, plastic bag ban, restriction on sales on tobacco and alcohol near schools, and school-based health centers. Honorable Madam Chair and distinguished members, if health of everyone in the CNMI is to be improved, it takes policy changes and it also takes funding. Paratasottaha is simply not an option. We need to reduce health problems and improve health outcomes. An integrated health system that already exists in CHCC is the best way to do it. And while we have hardworking and dedicated staff committed to getting it done, we need your help. Thank you for the opportunity to bring together the best minds and ideas to serve the CNMI residents more efficiently and cost-effectively, and to engage government stakeholders as active partners with shared responsibility toward our common goal. The CHCC leadership and I are here to answer your questions. This is Masi and Olamoy. Very respectfully. Thank you.
Thank you, Ms. CEO Esther Munia. I'd like to recognize the presence of our speaker, Edmund Villagomez. Thank you, Mr. Speaker, for your presence today. And at this time, members, I'd like to open up the floor for questions for the CEO or for her team.
Yes.
Representative Atsau.
Thank you, Chair. This is maybe not more so a question, but a continuing dialogue with CEO with the enabling legislation of 1651 as amended. If we can revisit that and see what needs to be done to tweak that law as amended, so we can allow more flexibility for CHCC to be able to improve its status within CHCC, and in addition to the other stuff that we need to do on our level. But if we can work on that as a priority for this committee with CHCC, so that it gives you some flexibility and the ability to move forward without the roadblocks that specific enabling legislation had put on CHCC. So we'll continue that dialogue with your office. Thank you.
Thank you. Thank you very much. I believe there is a fixer bill that was submitted at the last legislature.
Yes, I wanted to chime in on that, Representative Attel. I did see legislation. I don't think it was actually introduced though, but to revisit the corporate governance structure for CHCC. And my understanding was that comments were submitted a couple of years ago, but that perhaps we need to revisit that, particularly in light of all the changes and the COVID-19 response, how that may have also that may also impact this legislation. So we will add that to the list. Thank you. Other members with questions? Vice Chair Stapler.
I have not read the paper today, so if it was in the paper, I apologize. But can you tell us the current vaccination rate for the community that has already had access to the vaccines? Like what, do we have that kind of number at this time? Thank you.
Yeah, so in our website, if you go to chec.gov.mp, there's a dashboard there. It actually adds there's a tab for the number of cases, and then there's another tab on basically on vaccination rates, and it does separate per island. And right now we are above 10% of our population that we have vaccinated. We have opened 1B to include all public and private sector essential services frontline staff. And as we continue to monitor the allocations, that has been a challenge for us is, knowing exactly how many are coming. And when we do, sometimes it just takes a while for it to be delivered here. So right now we are, I believe, down to probably another week of supply for the first dose. We are keeping the second dose to ensure that, of course, with the delivery issues, we wanted to make sure that the second dose is available as well. So that's it.
Thank you. And on the subject of vaccinations, as there have been discussions about creating this travel bubble and perhaps opening up the economy once again to tourism in some limited way, is there a plan to adjust quarantine and other travel-related protocols for arriving passengers who have been vaccinated?
Right now, no. The concern that we have, of course, is there's a new variant out there, whether it's UK or the South African one. We need to be careful. Again, we may have you vaccinated, but it protects you, definitely, but it doesn't protect the community, right? So we need to make sure that our protocols are actually, at this time, it has to remain the same. So even with the travel bubble, the idea, and this has been in a discussion with everyone involved, is that we need to ensure that the same protocols are applicable to the travel bubble.
Thank you. Any other questions from the members? Representative Manglona.
Thank you, Chair. While we're on the subject of vaccination, it is my understanding that Rhoda was allotted 600 vaccines of Moderna, at least 300 for the first dose and 3 for the second. I'm not sure what the numbers are for Tinian. And from my understanding, there was only one date that was scheduled for the first dose. Are you considering opening up or scheduling more days? And if not, what are the challenges that you're facing in trying to get the vaccines out, at least for 1AB or 1A?
Sorry. So yes, we are going to be putting more, getting the vaccines out there to the community. We are actually scheduling it for this Saturday. the great thing about Rhoda is that the infrastructure itself can probably handle more vaccines compared to the island of Tinian. It is a smaller facility. So we were able to vaccinate over 150 this last Saturday, and there's some hesitancy. I have to say that there's some hesitancy of getting the vaccines, and we'd like to get more people vaccinated. But of course, the working it takes a lot of coordination with other other agencies to ensure that we get these vaccines to the people. But there's definitely a plan. They can do it, but it needs to be rescheduled. Scheduled. The thing with vaccines, it's not only just the refrigeration. You have to thaw it out. You have to get the syringes, and you have certain time to use it. So pre-registration is very critical, and we want the entire island to, if they're going to be vaccinated, and we want to do a mass vaccination, it needs to be. People need to register, and that's something that's a little bit of a challenge sometimes.
When do you anticipate openings up to 1B?
So 1B will likely either not after this weekend, probably next weekend. Yeah.
All right. Are you for now, Chair? Thank you.
Thank you, Representative Manglonia. Any other members with questions? Representative Abate.
Thank you, Chair. Thank you, CEO, for being with us today. And thank you for sharing the draft of the white paper. There are many priorities and many issues facing our Commonwealth. And as we're all aware, we do have a 2-year term. So based on your experience with working with health committees in previous legislatures, can you provide some feedback and maybe share your vision on how you hope to see our working relationship develop?
First of all, I want to, again, I really appreciate the opportunity here. I think this, we actually did, we were considering calling you all to our office and, presenting for, exactly what's been happening with health for the past 2 years. So this is very refreshing, to come to this, and I hope that we can continue the dialogue, as someone had mentioned earlier. It is very significant. Again, this is our health center. It doesn't belong to me. It doesn't belong to any one of us. We're here to try to help our people, and if there's ways we need to improve, I wish that we could all look at this as an opportunity to fix the health of everyone. And, improving the access, again, is very critical. But again, the pillars of access includes affordability, accessibility, and those things are sometimes very difficult, and it's been a challenge over the years. So feedback, let's have that dialogue, and we can go from there.
Thank you, and I completely agree. And I think this is a great committee that will encourage open dialogue and communication with CHCC. With the pandemic happening, right, it really exposed the vulnerabilities in our government and agencies. Can you maybe briefly describe the vulnerabilities that you saw with the introduction of the pandemic for CHCC, for our healthcare system in the CNMI, and maybe share your thoughts on that?
Yes. So, we talked about medical referral. I think that's also key. People don't want to leave the island. In the last year alone, people were even afraid to go to CHCC. We know that there had been a delay of care. This is one of the reasons why we got to get back to normal. Unfortunately, there's just so many things going on right now, right? I mean, the people that are involved in vaccination and border screening are the same people that are here. They're there everywhere, and some of them have not taken a break. I mean, we're right now even talking about annual leave. I mean, the staff are saying, I didn't take my annual leave this year. How am I going to get compensated for that? You know, I mean, you know, every year we start chopping it off, right? That's in the law. But, you know, how do you tell your staff, oh, I'm sorry, we're going to chop it off? And of course, it goes to the sick leave, but still, we didn't even give them that opportunity. We didn't even give them that choice. And so it's been, you know, trying to take care. But then we also know that our population is really needs healthcare, and we have to figure it out. You know, I mean, we've put out, we managed to go ahead and open the oncology center. I mean that during the pandemic. So we wanted to make sure things move on because we know how critical it is for our people. And you know, it's been one of the things that come to mind when we decided to to put out our response is that we needed to make sure we knew who had COVID, right, so that we could contain it. And so we built up our laboratory system to make sure that we are able to detect here. You know, thanks to the federal government for providing a lot of financial support for that. But we also worry about our fragile health system. You know, could we handle a surge here in this community with our health system? And so it became our commitment to try to contain this, and that's why we were right there. You know, we needed to make sure that we had. I mean, even that 2 lives that we lost, that really punched us in the gut, right? Because this is someone that could have been saved, but we just did it. You know, first of all, it was very new at the time when those cases came to us. So it is, we have people that are, I mean, my gosh, we're seeing oral cancer. That's been really just heartbreaking every time we see a case. There's the cancer, talking about oncology, the numbers have doubled, from, I mean, I may be wrong on that with Dr. Tadella here, but it's a lot. And, what can we do? And it's, we're trying to work on our campaign to try to make sure that, to push out the message of how to, how improve and get a better health outcomes. And so, yeah, it's heartbreaking.
Thank you. I too share that heartbreak. I am so grateful for all the good work you and your team do at CHCC. Congratulations on the opening of the Oncology Center. And for now, Madam Chair, I yield time. Thank you.
Thank you, Representative Abata. Any other questions from the members? I do have a couple of questions for you, Madam CEO. On the subject of medical referral, I did review the white paper that was submitted. Thank you for that. And I was really struck by some of the numbers that were cited in this paper. Since an orthopedic surgeon was hired at CHCC in 2017, referrals for orthopedic surgery have declined by more than 80%. An ENT was hired in 2018. Referrals for ENT purposes dropped by more than 90%. With the establishment of the Oncology Center, referrals for oncology decreased by almost 95%. That is nothing short of remarkable, especially considering the financial constraints under which CHCC has been operating. But it did make me wonder, why are we still overspending in medical referral to the tune of tens of millions of dollars? And I wanted to ask, originally the administration had proposed transitioning the program out of the governor's office to CHCC beginning in this current fiscal year. And I understand that transition planning began sometime last year, in the summer of last year. How far did CHCC get in this process? And how much data are actually available on the types of medical services that patients are being referred to off island still, and the expenditures that are related to care, airfare, stipends, lodging? How far did CHCC get in that process?
Could I ask Dr. Tudela and maybe
Sure,
Caitlin?
and you can bring your team up here if
Yes,
that would be
and,
helpful.
Just especially since the author of this white paper really is Caitlin.
Sure.
And she's done so much research on this, as well as a white paper that she did, right? I mean, one of the things that we had to prepare ourselves for this transition was getting the data, right? Getting the data, getting the records, and Caitlin was assigned to do that, and she did an excellent research on it. And anyway, so she's here to, I guess, talk about what you found.
Okay, and if
then
you
Dr.
could both please introduce yourselves and your positions for the record. Thank you.
Thank you.
Good morning. My name is Caitlin Nisis. I'm the Special Assistant for Policy, Sustainability, and Development. I work directly for the CEO. Last summer, we started, in fall, we started doing research on the program because we thought that it was going to be, our responsibility very soon. So we got data from the Medical Referral Program. We interviewed members of the Medical Referral Committee, who are right now all staff of the CHCC. But the data primarily lies with the Medical Referral Program. The committee doesn't keep any records. So we did develop a paper. We looked at policy over the years, regulatory changes for the program over the years, and expenditures to try to better understand, where the cost increases were coming from, if it was because of regulatory changes, benefits increases, those kinds of things. We didn't come to a great conclusion. It's still kind of mysterious, but we do have a paper. It's about 20 pages with some appendices on those expenditures that we prepared for management and board to really understand, what we would be dealing with, what kind of expenses we would be facing, and also we put together some recommendations for cost controls and improving the quality of the service as well.
And Madam CEO, would you be able to provide that paper to this committee?
Sure. Yeah.
Thank you. And Dr. Tudela, if you could also introduce yourself.
Good morning. I'm Dr. John Tudela. I'm the Chief Medical Officer. I actually took the helm in 2016 as Director of Medical Affairs, and then, since then, I've been putting into reality some of the things that I wanted to bring back to the island, and I'm very, very grateful that the CEO and her team are open-minded, but it comes at a great cost, as you know, and it continues to be a big challenge. So, answer your questions as best I could.
Thank you. Colleagues, did you have any questions for either Dr. Tudela or Ms. Mokanu? Okay, I actually do have one question that was raised with me by a constituent, and I was curious. Are there medical professionals represented on the COVID-19 task force who are driving decisions and making sure that they're evidence-based or science-based as we figure out how to deal with this COVID-19 pandemic?
Yes, I'm the unofficial advisor, mostly because I am everywhere and I can't be at many places at once. So Chairman Villa-Gomez has reached out to me in discussion regarding complex issues that they would like me to provide feedback and recommendations. So yes, I'm still on the COVID task force.
Okay, thank you for clarifying that. And if there are no other questions, I think we can close this part of our meeting. You're more than welcome to stay, and your team as well, Madam CEO. And we are opening up for public comments at this point. Unless you have anything else you'd like to add. Sure, Dr. Tudela.
Yes, I would like to make a comment on why we still need medical referral. There are a lot of services that are still not possible here. Radiation therapy for cancer. more complex surgeries that are not done here. So there's quite a few cancer patients that still go off island. But the initial part of the diagnosis can be done here, and then the treatment plan, depending on the complex issues. And then also we have a lot of cardiology patients. We don't have a cardiologist here. Even in Guam, they don't have a cardiothoracic surgeon. So there are some facilities that are just not feasible here. And you're always going to have a mechanism to get people the care they need. And so, unfortunately, medical referral will still be costly, and it'll still be needed in terms of our population and our community. So that would be the answer to that question.
Thank you. And actually that raises another question for me, Dr. Tudela. That is the subject of inter-island medical referral, which Representative Manglonia raised earlier in this meeting. And the white paper addresses that to some extent. And perhaps one of you could speak to CHCC's plans. Inter-island medical referral is generally locally appropriated, but also is the costs are generally borne by the CHCC, correct? So could you speak to CHCC's plans to perhaps expand on-island healthcare services, including dental care? We've been asked about that by constituents, to reduce inter-island medical referral costs as well.
So, obviously, Dr. Tudela and Dr. Conan back there, she's been really taking the lead also on this to try to expand the services to the island of Rota and Tinian. Dental services do come monthly to both islands. Dr. Sabino makes sure she spends at least 2 days, I believe, there. And on top of that, we're trying to also bring some specialty care. So for example, Dr. Brett, the oncologist, does make that visit. And of course, I'll leave you to Dr. Tudela.
So one of the plans for this coming fiscal year that I propose in the budget is to beef up the manpower in Rota and Tinian, which includes a physician for both islands on top of the mid-level providers or the advanced practice clinicians. And we do have plans for having the specialties come to visit and do their clinic on the island once a month to start, and depending on the need, it could be more frequently, and then determine who in their population pool requires a referral to Saipan for additional testing or treatment. So those are ongoing plans that I have envisioned, and hopefully, again, we find the people to come to practice and live on Saipan, in Tinian and Rota. That's been the biggest issue, is recruiting and sustaining the services once we have it. And so it just continues to be an enormous challenge for the islands.
And thank you for that update. And Ms. Makano, did you want to add to that?
Sure. Yeah, I just wanted to, about teledentistry and dentistry. Dentistry has been a huge need on Tinian and Rota for a very long time. And the volume, the population, the isolation of the islands has made it really difficult to have a full-time dentist on staff there. So we've developed a model using teledentistry under the leadership of Dr. Sabino in our dental clinic. And they've established dental operatories on Tinian and Rota to go visit once a month to each island. But to establish ongoing, regular, full-time care, we are planning on hiring dental therapists and dental assistants for both islands to be supervised remotely from Saipan. And we've been able to procure some things that we need through grant funding, but we still have needs for capital investments, especially for dental software, that we can't find a grant that will cover. This model is fairly unique to other telehealth models, in that the telehealth part is actually between the dentist and the mid-level professional, and not between the professional and the patient. So grants typically in telemedicine are set up to support models where it's direct patient to provider communication. So we are having some challenges funding that. But if we can fully finance that, it would be, we estimate that it would be financially sustainable from then on. So the revenue would sustain the operation. and it would provide full-time dental care on Tinin Rota.
Wow, that's wonderful. Thank you for those updates. That sounds very promising. I actually, a couple more questions did come up, and since I have you here, I wanted to just put this out on the floor. Some of my colleagues and I have received concerns from constituents about the overall system of care available to support victims of domestic and sexual violence in the Commonwealth. And I wanted to ask, are there resources at the CHCC that are dedicated to supporting victims when they come in to the healthcare system for help? And is CHCC represented on any of the various community bodies that are advocating for policy change or other services for victims of violence, such as the Coalition Against Domestic and Sexual Violence or the Family Violence Task Force? Is this anything that has been on CHCC's radar?
Dorena? I have Reina to respond to that. I mean, is it okay?
Sure.
Good morning.
Good morning.
Reina Saras, the Director of the Community Guidance Center under the CHCC. We do have mental health providers and those in our field that are represented on the Coalition Against Domestic and Sexual Violence. They work with both children and families affected by trauma in the form of domestic and sexual violence. And so we do have that partnership with the coalition primarily. We also work with, of course, the CNMI public school system and private schools. I want to say the interagency at different ages as well.
Thank you for that. And then my final question, as you know, Madam CEO, the report on universal coverage options that CHCC was directed to prepare is due to the speaker in March of this year. And I wanted to ask, are we on track for that? And can we schedule a hearing on the report sometime in early April?
Yes, we are on track, and we will be able to submit something and have that hearing.
Great. And this is more of a housekeeping thing, but the regular standing meeting of this committee is generally the second and fourth Friday of the month. And so would April 9th be a good time to just block out that date and schedule a briefing on your report?
Right now.
Okay. Does that work for the committee members? Okay. Representative Donald Manglonia?
Thank you, Chair. And if you are done, I just have one quick question.
Sure.
As you may be aware, MHS is having a soft opening today, Marianas Health Services. I don't know if you guys have a partnership with them or work with them. I'm not too familiar with the organization, but if I guess I just want to find out what benefit does this have to CHCC, or is this something that you will work with MHS, Marianas Health, or are you?
I guess Marianas Health Services is a private company that helps with home health, home care. We don't directly partner with them. It's actually the choice of the patient. We cannot tell them whether or not to choose Marianas Health Services versus Marianas Visiting Nurses health company. So we don't have a direct relationship to them.
Okay, yeah. I just asked because something like, one of the services they provide is physical therapy, and from my understanding, one patient who was referred to Saipan for physical therapy can stay on Saipan for 3 months, and that you're talking about 3 months of stipend, or if there is stipend, 3 months of hotel accommodations and all this stuff. So maybe this is something that we can look into and try to see how we can save CCC or support MHS if that's something that we need to do. Thank you.
Thank you, Representative Maglonia and Vice Chair Stapler.
Thank you for bringing that up. I actually did want to share that I was interested in seeing if it would be something that the CHCC and all other medical association entities or entities out there, if maybe we could consider looking at creating a medical association that would be something that we could do like a data sharing, which I don't know, I know data is really private, but at least for general numbers so that when we look at the overall picture of our community, I mean, we have numbers from one entity, but if we looked at all the entities that would be willing to share, we could see such a bigger picture of what we could invest more heavily in, you know what I mean? Is that something that, our largest healthcare entity would be willing to participate in if we were to forge ahead? Thank you.
I'm looking at Caitlin because there is the data warehouse that she can speak about. Sorry.
It's Caitlin again. I appreciate data-driven thinking. And so some of the work that Medicaid is doing, which, when you bring them in to talk about the buy-in option, they are investing in their data systems, and it is a requirement of U.S. Congress as kind of just a requirement of their increased funding. But the Medicaid program is the largest payer in the CNMI, and the claims data from the Medicaid program can kind of meet those needs that you're talking about. Is what is the utilization of X service in the CNMI, and that would go a long way for that. And then the CHCC can combine or can contribute our data as well. So between Medicaid, which is the largest payer, and CHCC, which is the largest provider, we would see the bulk of that information. And we can also have private insurance companies submit their claims information as well to really see a full picture of utilization of services in the CNMI. So it wouldn't be absolutely everybody, but it would show a lot. Thank you. Thank you for asking.
Thank you, Caitlin. And if there are no other questions for the CHCC team, we can close this part of the meeting. And thank you. Oh, Ms. Munia, did you have something to?
I just want to recognize Tyra Sablon for this beautiful marmar that she had given me.
It is beautiful.
Thank you.
Yes, and thank you all for your presence today and for all your hard work, keeping our community safe, keeping us informed. We look forward to continued partnership with you in this term. And I'd like to recognize the presence here of Representative Selena Babata. Did you have something you wanted to add before we?
Yes, Madam Chairman.
Sure, please.
I just have a question for the CHCC team, and I'm sorry I came here late. Maybe you may have discussed it already. I was busy out in the community. I'm a military family member, and I just wanted to ask, and I'm very concerned about the services that are much needed for veterans and even military families. There's been focus on veterans alone, and Dr. Tadala here is a veteran himself. Are there any counseling service? And I don't know, Dr. Adda is the VA contracted physician for medical needs, but a lot of our veterans have experienced trauma because of their multiple deployments, and that certainly impacts family life as well. I know, I speak it from experience. So I'm wondering, is there a resource out there for veterans and their families too, and children? Because I think it is much needed, and even the children, and I'm hoping that I can get a resource person or department from CHCC or mental services so I can extend it out to the veterans and their families and children. Thank you.
Thank you. Thank you for raising your concern, definitely regarding military families and populations. Thankfully, we have Dr. Glenda George, who has worked in her previous experience with veterans and their families. She is our clinical services officer and leads our clinical team as our psychologist. And so, yes, CGC would be the point of contact, and she has received Referral, she's also worked closely in areas where if we are not able to provide that level of care, she would network then with the Veterans Office and determine the different levels of care. But we do have different levels of care. We have, and based on where she feels the appropriate level of care would be guided, she would present to the mental health counselors and or herself. But I would recommend that CGC, there is that one number, and I can definitely connect with you after to share that resource with you.
Thank you. May I ask another question? In relation to veterans and their families and the need for social services for them, there is a program, and I think Dr. Tadela is familiar with it. There is a program called Family Care. It's a federal program called Family Care, in which family members or caretakers can be paid through federal VA funds. And it is not extended out here to the CNMI. It is in Guam. And many of these veterans experience severe trauma to a point that they just can't be out in the public. Aside from physical disabilities, they have also psychological issues. And I was wondering if I could be pointed to or give me the contact for Dr. George so we can try and bring that program here, because many spouses do not work because they have to take care of the needs of their husband or their veteran. And parents also can be included in this program, and it's a tiered program depending on the severity of the disability that the veteran is experiencing. Thank you.
Thank you. We'd be more than willing to meet, to address.
And to your point, that is actually more of a policy level to change to recognize the CNMI as a region for services. So at your level as a legislature, I think you could probably influence the right people in the VA to recognize us. Because right now, that's why we have a contracted CBOC, a community-based clinic with Dr. Ada, because of that limitation of us being recognized as a population, as a region. They lump us into Guam, basically. So.
Yeah, thank you, Representative Babauta. And I am aware that the family caregiving program is an issue that has been taken up by Congressman Kilili Sablan as well. It is absolutely a policy decision that needs to be made at federal levels to make it available here, and it is needed, absolutely. But thank you. This brings us to the close of this portion of our meeting. I would ask that we take a 5-minute recess, colleagues, and we'll come back to accept public comments in the next half. Thank you, CEO. Thank you to your team. Seats, please. Members in the gallery, please take your seats. John, are we live? Okay. All right, at this point in our agenda, we will open up the floor for public comments. We do have a few people in the gallery who have signed up to provide testimony, and I'd like to begin with Ms. Jennifer Maratita. If you could please come to the chamber, our acting sergeant at arms, Mr. John Diaz, will be escorting members from the gallery who would like to testify. And if you could please state your name, the organization that you are representing, if applicable, and limit your testimony, your oral testimony, to 3 minutes. Thank you.
To press it? Oh, got it. Thank you for giving me the opportunity to speak with you, for putting advancing LGBTQ equality and well-being in the CNMI on the legislative agenda. My name is Dr. Jennifer Maratita. I represent myself as a mother and community member. I'm a licensed mental health counselor in the CNMI for the past 15 years and was invited to speak on legislative issues for equality for LGBTQ community. I've, in the past, founded Pride Marianas Youth, which is a grassroots organization, a spin-off of Pride Marianas, an adult organization, alongside a large group of volunteers. And these past years, collaboration with some champion partners like CHCC, CGC, the Northern Marianas Coalition, the PSS school system, NMC, and others. I also have a large group of volunteers, and some of us are here today. I'm going to ask them to wave hello.
Good morning, welcome.
Some of our
Thank you.
Pride Marianas youth volunteers. We aim to raise awareness of more inclusive, braver, and safer spaces for our community, and I've had the privilege of providing some counseling services to those in the community. I've been close friends, a family member of people who identify in the community, and with my son's permission, I'm also the mother of a child who identifies as transgender, along with his siblings who identify as allies and on the spectrum. If you take a look at the Movement Advancement Project, it maps out the status of LGBTQ equality of mapping various laws and policies that impact LGBTQ plus people for an estimated of 40 total laws and policies. Puerto Rico is the highest rank, that has 21 out of 40, and the CNMI ranks 3.5 out of 40 for sexual orientation policy, and -1 for gender identity tally. I didn't know we could actually be in a negative. When we're talking about our youth who identify in the Pride community, we're not just talking about sexuality, we're talking about gender identity, we're talking about attraction, whether it's emotional or romantic. We're also talking about gender expression, whether it's how you dress or act via social norms or gender norms. Specific to our LGBTQIA youth, we've seen our youth reporting several surveys on vulnerabilities and experiences. When we say LGBTQIA+, we're talking about L, lesbian, G, gay, B, bisexual, T, transgender, Q, queer and questioning, I, intersex, A, gender ally or asexual, and the plus is for others. According to the US statistics, 3 to 5% of our population identified as LGB. However, CNMI Youth Risk Behavior Survey in 2019, our LGB students represent 13.2% of the PSS students who were surveyed. In a PSS population of an estimated 10,000 students, that would mean 1,320 of our students identify in the spectrum. And the survey has not been updated to ask for those who identify as transgender, non-binary, and expressions or identity. Whew, this is my first time. 3-minute mark.
You're doing great. Well, we're actually a little bit over, but please go ahead.
Can I get an extra minute or two?
Sure, continue.
In my research as a mother, I came across some hard statistics I wanted to share. I don't have to continue to hold it? Okay, cool. So out of the YRBS and the CNMI, approximately 15% of our LGB students, which is 198 students, did not go to school because they felt unsafe one time at least in the past 30 days. That's twice versus their heterosexual peers. For those who identify in LGB in the CNMI experienced sexual violence by anyone in the past 12 months of the survey, which was 27% of those students, which is approximately 356 students, almost triple their peers. 22% were physically forced to have sexual intercourse, which is about 290 of our students, which is almost triple the rates of their peers. It's hard to read. For those who had felt sad or hopeless in the last 12 months, was 65% of the LGB students, which again is statistically significantly higher than their peers. That's about 856 students who reported feeling sad and hopeless. And for those in the past year, had seriously considered attempting suicide, which was 46% of those students, which is about 607 of our kids. When you think about suicide in terms of not just having thoughts, but actually making a plan to end your life, 580 of these students reported that in the past year. And in the past year, in the last year, 448 of them had made an attempt to end their life. 10.9% of them in their attempt needed serious medical attention. That's 143 of our kids. These are CNMI YRBS statistics, not just the US. So I just want to pause. These are our kids. Please take a moment of your time to pull these stats from the CDC website, and the trend data is showing that our CNMI students are reporting increases over this past 6 years. So I have 3 minutes and I'll wrap up. I invite you to conduct a needs assessment of where to start. This public comments is great, but it's also great to collect qualitative data from our community members. I've had 3 days to pull some thoughts with this invitation, and thank you. I would like to see greater healthcare protection so that when a president says that your gender-affirming healthcare will stop, it will not be an immediate cost to family and individuals that can be upwards to the amount of $2,000 a month. Help the CNMI government establish policies so there's no confusion about language. When someone harasses you at work because of your orientation or does not validate your gender identity or name, that this is in the realm of harassment. Require annual trainings of all healthcare workers, government staff, and educators on inclusive language and protection laws. Protect our kids so that no coaches or parents will exclude transgender kids who cannot play on their authentic gender team. Provide access to gender-neutral bathrooms so that schools will not be left to interpret access and our kids are protected. Secure funding towards improved protection for equality and access to mental health care and psychological specializations, or improve telehealth connections to stateside specialties, as well as a CHC-identified LGBTQ advocate or AN team. Training of medical professionals and educators and all government staff, and improvements on our resources for advocacy and awareness for our community members and protection of our youth. And thank you again for bringing this to the agenda. Thanks for the extra minutes.
Thank you, Dr. Maratita. If we could please request a copy of your testimony?
Yes.
If you could submit that to the committee.
I'll
Thank
email
you.
that to you.
Yes, thank you. Next, in our public comments lineup, we'd like to invite Tyra Sublime.
Good morning, Madam Chair, Madam Vice, and committee members. My name is Tyra Sublime, and I am a proud transgender daughter of the Marianas. I have been living LGBTQ for 41 years, and I have lived through a generation when my kind was bullied, tortured, ridiculed, rejected, and killed. The motivation behind advancing LGBTQ equality and wellness is very simple. As we think back to an era not too long ago, where LGBTQ people were told we should go back into the closet, hide, and be ashamed of who we are. Respectfully, we are not going to go back in the closet, nor are we going to hide or be ashamed of who we are, and we aren't going to allow the youth to go through what we went through in the 70s, 80s, and 90s of abuse, suicide, killings, and the systemic and institutionalized discrimination that destroyed, if not ended, so many lives. Over the course of history, laws and policies, or lack thereof, enacted intentionally and unintentionally by our government, has led to much more than just inequality. They legitimize hatred and violence brought upon shame to all those targeted. And even though we, the people of the CNMI, have significantly progressed, our laws have not. Laws and lack of inclusivity and protection that have created a culture of stigma and hatred towards LGBTQ people, which have consequently devastated so many. We in the community are working very hard to eliminate disparities that affect the LGBTQ community so that we can live healthy, prosperous, and harmonious lives. With your support, we can eliminate the systemic and institutionalized oppression that has plagued the LGBT community for so long. On behalf of the LGBTQ community, the youth, adults, elders, and our family and friends, and allies here in the CNMI and all over the world, We'd like to thank the committee for taking this opportunity to continue to provide safe and inclusive environment for generations to come and leave behind a legacy of love. Thank you.
Thank you very much for your testimony. If you could provide a copy to this committee, that would be helpful. Next, I'd like to call on Esther Fleming.
Good morning, Madam Chair, members of the Health and Welfare Committee. My name is Esther Fleming, and I'm the Executive Director for the Healthcare Professional Licensing Board, and I also serve as their Director for the Professional Licensing Board for the professional engineers, architects, appraisers, surveyors. I'm here actually on behalf of the board, the Healthcare Board, and I wasn't prepared. Actually, I had too much on my hands yesterday. I had to respond to a family crisis. The public health CHCC was just here earlier. It kind of came too close on a family member that had COVID-19, a sibling of mine, as of last night. So we've been up this morning. I have to call for the prayer warriors. And
Sorry to
good
hear
news.
that, Ms. Fleming.
Yes.
We will keep your family member in our prayers.
Yes, so it's been a long evening for the Sablon compound. And, but he's good. I'm just very thankful that we had a retired physician in the family who is actually retired in the U.S., but he took care of everything else and kind of helped out at the hospital that he also does provide volunteer work for. But I'm here. It wasn't until just recently, and the board just met maybe about a couple of weeks ago, no, a couple of days ago. And the only thing that we are asking, the chairman had written to you in an email, I think that was only yesterday. The chairman is Ted Parker, better known as Ted Bravo. And in that meeting, the board would like to ask the committee, and we don't have the proposed language for it, if we can work with anyone here in coming up with the language. All we wanted is, and it's been very hard in the years that I've been with the medical board and even for the professional licensing, is trying to get volunteers who can work with us as board members. And we wanted, the board have asked for the possibility of just getting rid of terms, board terms, especially for the health care. I've asked around for people that have been on island, and they're all mostly overwhelmed. The composition of the board requires at least 2 physicians, 1 dentist, and the other 2 could be anybody that does have the healthcare background. And for now, we do have the clinical psych that handles all the professional counseling. And then the other one was the 2 physicians, 1 dentist, that's 3, 1 clinical psych, yes, and that's the whole thing. And we have 1 physician that expired just several days ago, who is more than willing to continue with the board, but she says unless we get rid of the terms, I went around and I asked other people on that are in the healthcare if they're physicians, but they just couldn't. They're just overwhelmed, not at this time. And so that gives us with just having 4 boards. The only thing that we wanted to be to make sure that we're consistent with the public law is to ensure that that also serves, that we also ask that they served also once they expire, that they continue to serve until a nominee has been confirmed, so that we continue to screen out. It's very rigorous. We need people with institutional mind on regulations to ensure that the healthcare, we provide the health and safety of the community. And it's not easy when you have people that are only here on contracts 4 years, even 6 years, and then they have to move out of their contracts for going home. And so the board really are asking due diligence on your part and for your understanding to be given that possibility of just getting rid of the terms. We did it for the professional licensing board, and that had really helped us. You know, we don't have that much engineers on island, and so we've been very consistent with a lot of our regulations as they screen through by. That's it.
Thank you very much, Ms. Fleming, and we will take note of the board's request. Colleagues, for your information, I did just receive the email from Chairman Brabu, Chairman Ted Parker, and I will be sharing it with the members. And we can move forward with developing the legislation. It sounds like we would already have a template anyway, based on what was done with the professional licensing board.
Yes, and I did provide you with that.
Yes.
Thank you.
Thank you so much. Have a good day. And next in our public comments list is Ryan Camacho. If you could please just state your name for the record and the organization that you are representing, if applicable.
Good morning. My name is Ryan Camacho. I am representing myself and as a member of Pride Marianas Youth. Dear honorable members of the legislature, I want to begin with an excerpt from a poem by Charles C. Finn. I wear a mask, 1,000 masks, masks that I'm afraid to take off, and none of them is me. Beneath lies no complacence. Beneath lies confusion and fear and aloneness. My mask is a nonchalant, sophisticated facade to help me pretend, to shield me from the glance that knows. But such a glance is precisely my salvation, my only hope, and I know it. That is, if it's followed by acceptance, if it's followed by love. It's the only thing that can liberate me from myself, from my own self-built prison walls, from the barriers that I so painstakingly erect. It's the only thing that will assure me of what I can't assure myself, that I'm really worth something. I learned this poem back in high school, and it really touched me then, and it still touches me now. Because it reminds me of the difficult times I had growing up as a young gay person here in Saipan, Mariana Islands. At that time, I didn't realize the acceptance and love that I had from my friends, my family, and the support that I had. They were protecting me from the belligerent bullying and aggressive assaults. But they are the ones who tore down my barriers and allowed me to accept myself. They gave me the strength to brave challenges and adventures, to shine authentic joy and laughter. Today, you have an opportunity to break down barriers of hatred and discrimination. Today, you have the power to build pathways of support and encouragement for our brothers and sisters, our sons and daughters. I challenge you, leaders of the CNMI, to be brave, to deliver that glance of salvation and hope, to create a CNMI community where LGBTQ plus persons can be free of their masks and present their authentic selves, for we all are really worth something. Thank you.
Thank you, Ryan Camacho. If you could share your testimony with the committee. Thank you. We don't have anyone else signed up to provide public comments, but we do still have time. If there's anyone else in the gallery who would like to make comments, now is your chance. Okay, and seeing none, we can move to the next order of business in our agenda, and that is discussion and announcements. And colleagues, at this time, I'd like to open the floor for any comments, any discussion, your thoughts about next steps. I have some as well, but the floor is open. Representative Eto?
Thank you, Chair. Just under discussion, Ms. Fleming, it just understatement under public comments. I think that's a simple legislation that we should tackle at the soonest, so we can get that out of the way and move on with that. Obviously, the challenges of getting people on the board is difficult, no? In addition to the work that they already have to undertake. So if we can get that legislation and just mirror it under the engineering licensing, so we can get that out of the House and it's on its way to the Senate for action. And as soon as I believe they're expiring in 2 months, and I'll say they're expired and they don't even have the opportunity to continue their positions as board members, unlike other boards and commissions that we have. Obviously, for various reasons, it's a lot stricter with that board. No? So with that, thank you again, Chair.
Thank you, Representative Eto. I agree. It seems like fairly straightforward and simple legislation, and I will share the correspondence that I received, including the previous legislation that had been adopted, with the members and council. And Ms. Sablan, if you could please take note as well. We could just get that started right away. Thank you. Any other comments, discussion from the members? On the issues raised by our advocates from the LGBTQ+ community, I would like to ask that we plan to have a hearing just focused on these issues, to do this needs assessment that Dr. Maratita recommended, to really identify where this committee can start in terms of shoring up policies that are more inclusive and provide greater protections for our LGBTQ+ members of our community, and particularly our youth. So let's start thinking about when we can do that. We do have a standing meeting, as you know, colleagues, every second and fourth Friday of the month. I would like to request briefings with the COVID-19 Task Force Chairman. I just spoke to him during the recess, and he asked if we could schedule this briefing sometime after February 12th, just based on his own time constraints with the vaccination program. And then also invite Medicaid to come in on the implementation of Public Law 2128, and particularly the development of this Medicaid buy-in program, which we discussed earlier today. I'd like to invite the Northern Marianas Housing Corporation for an update on their food and housing assistance programs. And they're receiving some major grant awards for those and other social welfare assistance programs. The Substance Abuse and Rehabilitation Program Director has reached out. She has offered a tour of the facility as well as a briefing with all of the members. We can begin to schedule that. And then last, actually no, not last, the Nutrition Assistance Program. I've been communicating with the director on when beneficiaries can expect to see their food stamp benefits restored to previous levels now that federal funding has been increased. My understanding is they're looking at February, as soon as February, but it would be good to get updates about that, since I know many of us have been receiving inquiries from our constituents about that. And last but not least, going back to our discussion on the medical referral program, that review is long overdue. I spoke to Ms. Mokano during the recess. She will be forwarding the report that was prepared last summer when they were beginning to think about how to transition the program to CHCC. And so I think that would be a good place to start. And then we can begin to have hearings. And I would actually suggest that we have hearings on Rhoda and Tinian as well. So let's start planning for that, colleagues. Any other comments or announcements at this point? I have one last announcement. I did talk to the speaker about appointing new members to represent the House on the COVID-19 task force. I will be asking for myself and Vice Chair Staffler to represent the House, and that letter should be coming out shortly. If there are no other announcements or comments at this point, I'd like to ask for a motion to adjourn. Motion has been seconded. All in favor of the motion to adjourn this meeting? Subject to actually the next meeting is already scheduled for February, 1 second. Our next meeting will be on February 9th. So, correction, February 12th, which is the second Friday of February, 9 o'clock. So we will see you then, colleagues. Thank you and have a good day.